They arrived by the thousands, orders to appear in court for debt not yet paid.
I got sick. My blood pressure went up because I get scared.
Mysteries delivered daily to the doors of people with little more than one thing in common.
There's a lady here with some paperwork from UCHealth.
Each a one-time patient of the largest provider of healthcare in Colorado.
So I don't get to see the judge today about this? I'm accused of something that I never received a bill for. Right. So ridiculous.
Our investigation began with a question. If UCHealth was continuing to sue as many patients as we suspected, then why did its lawsuits largely disappear in 2020? And so we spent more than a year going to court, cold calling hundreds of people. Within their stories, we found a story of our own, a story never previously told.
I was shocked by your story. I was shocked at the volume of the cases.
Not only was UCHealth still suing patients, but it was doing so in the dark.
Couldn't you just sue under your own name? Could you?
It would make less sense, honestly, to do that because the debt at that point is assigned to the vendor.
It is an investigation.
And I want to give a shout out to several investigative reporters that have been following this for years. Chris Vanderveen and his team.
An investigation that changed state law, changed the way all Colorado hospitals can sue patients moving forward.
15,000 lawsuits in 5 years. 8 patients a day, roughly.
I think that's shocking, and I think that's not how it should be.
And in June of this year, it turned into an investigation that went national in scope.
Why did we come to Colorado? Because you broke the story.
9 News investigates debt in the dark. It was impossible not to notice. Every quarter for years, UCHealth sued its patients, hundreds every quarter, making it the leader of a dubious statistic in Colorado. No other hospital system sued its patients for unpaid bills more often. And then, right as the pandemic started, the lawsuits appeared to end.
Yes, it's very stressful. It is. I just don't know what to do.
It all made what we found in courthouses like this one in Adams County all the more peculiar.
I am very surprised. I was swept off my feet about it.
Here we found patients like Angela, who insisted UCHealth was still targeting them.
For some reason, they're suing me, and I've never seen any bills about it, any itemized bills about it.
North of Colorado Springs, we met Lorena Sanchez.
No more than an hour and a half. No more than an hour and a half.
That brief visit to UCHealth Memorial North resulted in a single CT scan that found nothing broken. She left worried she'd receive a bill for a few $1,000s. 2.5 years later, she received this lawsuit demanding $24,000.
But when you go through that and you see that dollar amount for 1 hour and a half, it doesn't make sense.
Here is where we found our first big clue. The plaintiff suing her, not UCHealth, but a business known as Credit Service Company, or CSC.
I got sick. My blood pressure went up because I get scared.
And so we tracked CSC's lawsuits, starting with all of the 1,500 it filed in Colorado in 2023. And we started calling the defendants, asking them if they understood why they were being sued.
It was a very weird thing. I was like, there's someone playing a prank on me right now. Honey, wake up.
Liz said she'd talk to us if we agreed not to use her name.
I was more than confused. Like, I couldn't figure out what this bill was, why I owed it, why I was being sued. I didn't know.
She says she too went to a UCHealth facility and insists she only found out she owed money when a man delivering a CSC court summons knocked on her door.
All that did was scare me. It scared me. I didn't understand what was going on.
I had never heard of them. I had to look them up.
Same story from Gabrielle St. James. Brief UCHealth visit, years later, CSC lawsuit.
This looks like a scam because it's a lot for doing nothing.
When these patients are getting sued, they're getting sued in the name of some debt collector they've never heard of and never had a relationship with.
Attorney David Seligman told us we found what he long suspected, that UCHealth found a convenient way to sue its patients, using not its own name as a searchable plaintiff, but under the name of its third-party debt collectors.
If UCHealth wants to sue people for unpaid medical debts, then UCHealth has to put its name on the lawsuit.
By the time we got around to asking UCHealth just what it was doing, its chief legal officer told us this.
Couldn't you just sue under your own name? Could you?
It would make less sense, honestly, to do that because the debt at that point is assigned to the vendor.
I'm not saying you can't use a debt collector. I'm just saying you can use a debt collector and still put your name on as the plaintiff. Can you not?
Honestly, in my view, that is more confusing.
We asked her, didn't it also make it nearly impossible to track the litigation practices of the hospital system?
This is the normal course. This is the way things work with these vendors, and it's how we do it.
But we found it's not normal. Intermountain Health, for example, discontinued lawsuits in October 2022. And Health One, the largest for-profit provider in the state, does not pursue litigation that involves suing patients.
I was shocked by your story. I was shocked at the volume of the cases.
State Senator Sonia Hawkes-Lewis saw our story. So did State Senator Lisa Cutter.
That was a great story, and I really appreciate the reporting.
Both agreed what we found was a loophole that needed to be closed.
What I can believe could be the case is the hospitals would find it a lot easier if their name is not going into the court system every single day.
Still confused? Here's the basics. Let's say Hospital X wants to sue Jane and John Doe for an unpaid medical bill, but doesn't want the public to know how often it sues patients like the Does. So it sues them under the name of a debt collector, and poof, no way for the public to link Hospital X to the litigation. House Bill 1380 effectively ended that practice.
And I want to give a shout out to several investigative reporters that have been following this for years. Chris Vanderveen and his team.
Starting in late 2024, if a hospital system in Colorado like UCHealth wanted to sue patients for unpaid debt, it needed to add its own name, and that in turn allowed the public to know just how often it's done.
Why did we come to Colorado and do a deep dive on UCHealth? Well, it was really because you broke the story.
Cynthia Fisher heads Patient Rights Advocate, or PRA, a nonprofit fighting for more transparency in healthcare pricing. Following 9 News Investigates reporting last year, PRA joined with researchers at Stanford and George Washington Law to see if they could verify what our investigation found. Spoiler alert, they did. We confirmed the findings of the 9 News investigation. UCHealth is the state's largest initiator of debt collection lawsuits against former patients.
I mean, it was so hidden that some of the patients didn't even know when they were sued for debt that it was medical debt.
By using third-party debt collectors as the signed plaintiffs on their lawsuits, UCHealth, says the report, attempted to conceal this, that it remains the state's largest initiator of debt collection lawsuits against former patients.
We found that they were an outlier and that they were extremely aggressive in their practices.
Often, the lawsuits resulted in requests for wage garnishments. More than a third of suits brought by one debt collector resulted in legal requests to take home a percentage of the defendant's pay.
Hospitals do a lot of wonderful things, and a lot of really heroic people work there, but they also are causing a lot of harm, and they simply need to fix that.
George Washington Law professor Barack Richmond helped author the study. He says the report tells him UCHealth didn't just conceal their lawsuits. They actively confused patients along the way.
We found, and your reporting, your terrific reporting has found, that patients just don't understand the bill. And that's because nobody understands the bill. The bills are totally ununderstandable.
In a statement, UCHealth called the study misleading and based on data that is up to 6 years old, adding 99.93% of all patient accounts are resolved without any issues. It's similar to what UCHealth told us last year when we first exposed the practice.
99.9% of our patients get through the process without any involvement from a collections agency or a court.
In the second half of 2024, and thanks to that change in state law, 9 News Investigates began to track UCHealth's lawsuits. When is the first time you find out you owe them money?
When I got served paperwork, a summons to appear in Grand County Court.
Dan Mayer received the summons in October. It informed him the business suing him was also the business that helped save his life.
I was diagnosed with metastatic melanoma.
A little scary?
It was. I remember when they called me and they said, we've got bad news, it's melanoma. And I said, is that bad? And the dermatologist kind of said, yeah, it is.
So you still don't really know what's going on.
No.
But they're suing you.
Yes.
And that doesn't feel good.
No, not at all.
Ayla wanted us to use only her first name. In September, she received this summons notifying her UCHealth was suing her for $1,828.19.
This is crazy because I just finished paying off all of the debt. I was like, what the heck is going on?
What the heck is going on? A valid question. But 2 years into this investigation, it is no longer a question in need of an answer. Unable to sue under someone else's name, hospital systems in Colorado can no longer do this in the dark. Chris Vanderveen, 9 News.